So you ran the CDC. We still have a CDC in the United States. It has management. We've also got the much celebrated Dr. Fauci. We've got Dr. Birx. They're still out there talking to the media all the time. How are the health professionals doing? How are they holding up right now in the United States?
Well, first and foremost, I think we need to do a much better job protecting people on the front lines. Every time I see the numbers of healthcare worker deaths, I see another healthcare worker dying, it's just heartbreaking. Here in New York City, Steve Kamholz was someone who I've worked with for years. He was 72 years old. He wanted to go in and help people. He got the disease. He was teaching from his bedside, trying to help people. He was just a totally committed physician. And to see someone like that die from this is horrifying. And I think it's largely preventable if we use a systematic way of preventing infections. And we get much better about face shields and reusable protective equipment and environmental and engineering controls, source controls, universal masking in hospitals. We should be able to dramatically reduce the number of healthcare worker infections and deaths. And that's crucially important.
We're 6 months in. Tom, are you saying we still aren't getting basic health protocols around coronavirus in place in hospitals? Are we lacking supply chain? What's the principal miss here?
Well, I think one of the most important things that we must do is be much more transparent with information. There have been more than 500 deaths of healthcare workers that we know of in this country, and more than 80,000 infections of healthcare workers that we know of. These are mind-boggling numbers. When I, early in my career, worked on tuberculosis, when we had a single death of a healthcare worker, it was such an outrage that there was national action to protect healthcare workers. So if we knew that, the number of healthcare workers infected in your area, every week in every area, I think there would be pressure to get that number down towards zero. Because it's possible. There are other countries that are not having this kind of infection rate in their healthcare workers, and we have to do much better